bunch of questions to ask. And it's
Edwin, if that blazer goes missing, you know who to look
if
for.
just know it's me. I collected it on your behalf. And of course, we'd like to know more about the Wezesha Elimu program. Why did you launch the Wezesha Elimu program? And of course, for how long have you been implementing the program?
Thank you so much. So, CBM Global has a lot of expertise in disability inclusion. And disability inclusion is about tearing down barriers to ensure that children with disabilities access education, access health services, and social protection services. Now, we realize that in education, there are children who have disabilities that can be corrected early in their life. So, for example, a child is born with a visual impairment, a condition that would make them go blind, but if that child is taken through surgery, that condition can be reversed, and the child should to go on with education challenges. So CBM Global Disability Inclusion, in partnership with the M-Pesa Foundation, designed a program bringing on board hospitals like Kiwa Kenya and also schools, some schools in Homa Bay County and some in Baringo County. And in this particular program, we essentially identify children with disabling conditions, some of them with physical disabilities. They can't walk, they can't stand, they can't sit. Some of them with visual disabilities. They need support to get low vision devices, surgery, and so on and so forth. And then we conduct the surgeries free of charge. We provide them with the requisite devices. We call them assistive devices. And these kids then are able to go to school. And when they go to school, actually, they perform very well. They learn side by side with their non-disabled peers. And this has really brought in so many children who would otherwise not be able to access education. So we've done this for the last, I think, 7-8 years, and we are looking at scaling up to other counties.
That's amazing work you're doing. And I was just looking at some of the numbers earlier. I think you've impacted a lot of lives. And by the time one child gets an assistive device or a surgery, that's a family that you've impacted, a generation. But could you just give us an overview of like how many people, how many children actually have been impacted by Wezesha Elimu?
So now we would usually talk about the primary beneficiaries and secondary. So in terms of the primary beneficiaries, those who have gotten those who have gotten devices, those actually have been supported with additional dignity kits, because some kids need to be things like diapers. So that, of course, because of disability conditions, we've supported over 1,000.
Wow.
But we know that larger secondary fishery data that we have reached 5,000, because then families, communities, teachers, non-teaching staff, county governments, we've been able to also build classrooms at least, and that is in partnership with county governments, and that has helped many more kids come to school or benefit in one way or the other in terms of education.
That's amazing